eDOKITA. Today, we'll be talking about PCOS. We have our medical practitioner on seat that will be highlighting us more on this topic. We have Dr. Tema Apata and Nurse Adebayo Ifeoluwa. Please can you say hi to the audience?
Hello, thank you for having me.
You are welcome.
It's good to hear.
Thank you, you are welcome. Okay, PCOS is a serious medical condition. So, what's PCOS?
PCOS means Polycystic Ovarian Syndrome. And now this disease is a hormonal disorder that is found amongst women of reproductive age. That's between 15 to 45-year-old. And now in this condition, you see that the ovary is actually supposed to progress and then develop its eggs and release its eggs. But that doesn't happen in this condition. It actually grows, but it doesn't release its egg. Rather, around the ovaries you see little follicles, what we call cystic follicles, that are cavities filled with fluid around the ovaries that fail to progress and release eggs.
Okay, thank you. So what are the causes of PCOS?
Okay, now actually we don't have causes, but we call them associated factors. Yes, and there are certain factors that are associated with the development of polycystic ovarian syndrome in any individual, in the female. Now the first one we must look at is hereditary. Genes. Genes always play a role in most diseases. If a woman has a mother who had PCOS when she was much younger, definitely there's also a likelihood, a probability of her having that same disorder, that's the PCOS. Another thing is excessive androgen production. Now, androgens occur in both males and females, but now in this condition we see that there is an excess of this hormone, and because of this excess of this hormone you see some other features that are associated, which we'll go into later. Another factor we could point to is insulin. Now there's excessive insulin production in females with PCOS. Now insulin is a hormone that helps us to control the blood glucose. Now in females with PCOS it is in excess, and it could also affect androgen production and also help with the development of the polycystic ovaries. Thank you.
That was a lot.
Okay, what are the signs and symptoms of PCOS?
Okay, firstly to start with, every individual with PCOS have different signs and symptoms. If I have PCOS, my signs and symptoms are different from me that have PCOS, but it's just that everything are still signs and symptoms of PCOS. So the major thing an individual will notice when they have PCOS, the major complaint most patients have is no menstrual period. They will complain that, doctor, I didn't see my period for 2 months, I didn't see my period for 6 months, and I'm not pregnant. So what can be the cause? So there's irregular menstrual period. Also there can be scanty menstrual period. Probably the normal cycle is the normal menstrual period is 4 days, and you notice that it's now 1 day. You should know that okay, something is wrong with me. But for the menstrual cycle, that's the signs still associated with it. But for physical, what you can see in an individual's body, she mentioned something of androgen hormone. Androgen hormone can be found in both male and female, but for people with PCOS, they have excessive production of androgen hormone, and because of that, you notice they have facial hair, they have hair on their body, they have hair where they're not supposed to have hair. But that does not mean an individual that has hair, like they have beard or have hair on their body, have PCOS. It's just a signs and symptoms that are associated with PCOS. Also, for some people, they have oily skin, they have acne on their face, but like I said, that does not mean they have PCOS, but those are just the signs and symptoms that say PCOS. But the major thing that a doctor will know that, okay, this person has PCOS, is not as if a general signs and symptoms is presence of polycyst around the ovary, and that can be known by telling them to go for a transvaginal scan, and when they go for the ultrasound, you can see visibly that okay, there are cysts around the ovary. You know that for sure this person has PCOS. It's not a different signs and symptoms. So yeah, those are the things that they with PCOS.
So does that mean that those women that have bears on their chest, have PCOS?
I didn't say that, so I'm just saying it's one of the symptoms. Those women that have beards, they have excessive production of androgen hormone.
There's something excessive in their body.
Yes, androgen hormone, an individual can have it. A woman can have it, but if it's in excess, that's when you notice that okay, the hair is coming out too much, or there are like lots of hair on their body. But that does not mean someone that has excessive, that has beard has PCOS. So it's just a symptom that's there with it.
Okay. And talking about menstrual cycle, how long is the normal menstrual cycle?
Okay, every female have different range of menstrual cycle, but it's between 21 to 35 days. However, there are different factors that can affect the menstrual cycle of an individual. Stress in particular, an individual that is stressed is likely to have like a variation in the menstrual cycle. So it's advisable that if your menstrual cycle is probably more than 35 days, it's advisable to see the doctor to know if there's something wrong. It can be stress induced, but it's advisable for you to know that okay, it's stress, not something else. So it's those are the range 21 to 35
Anything more than 35 days now?
Yes, anything more than 35 days already giving like an alarm that okay, something is wrong with my body not acting normally.
Thank you. So can we see this PCOS as a serious problem?
Yes, it can be seen as a serious problem if not properly managed, because it's a condition that requires immediate medical attention. It's advisable that when you notice or it's confirmed that you have PCOS or you have major signs and symptoms, it's advisable to seek medical help to help you with treatment early in life. For instance, for an individual, a child or someone like 18 years that notices that okay, I have infrequent menstrual periods from normal, it's advisable for you to like okay, see a doctor to tell you what is wrong. So if it's PCOS, you can start the treatment while you are might just know, not when you are much older and you are trying to get a child and it's not coming. So it's advisable that when you in an individual notice they have PCOS, you start treatment immediately.
So, can someone with PCOS get pregnant?
Oh, definitely. Someone with PCOS can get pregnant. You know, like we said, the key to this condition is early intervention. Now, once this condition is detected early, it increases your chances of getting pregnant once you institute treatment early on.
Having PCOS is not the end of the day.
No, it's not a dead sentence.
Thank you. So, what are the possible treatments for PCOS and things that we have to avoid?
Okay, so I would like to say at this juncture that treatment depends on the symptoms presented. For example, you see that there's excessive hair production, there's excessive hormonal production and all that. We treat according to those symptoms presented. But the first thing that we do for a patient with PCOS is history taking. So when you come to us in the hospital, the first thing we do is to take a proper history. You know, we want to find out what has happened to you in the past, your mother, your history, your medical background, and other things that we think might make you prone to having this condition. So we take a proper history. And then the second thing we do is to do a proper physical examination. So we like to examine different parts of the body. Already we'll see that that individual has some excessive hair production and other things that we would also want to look out for in that individual. Then we also send you for some blood tests. We already said that there's some hormones that are out of balance. So we want to examine the normal regular levels of those hormones in you, and then we also send you for an investigation we call the transvaginal ultrasound. Now that is very key to showing us and revealing to us the cysts that surround those ovaries. Then the next step of treatment would be to actually emphasize on weight control. Now, for most patients, we have discovered that once there is an excellent weight control, that person brings the weight under the proper
BMI.
Yes, the BMI range. Between 18 to 25. That's the regular BMI range. We discovered that most times the symptoms disappear. I mean, it gets under control and patient can continue get pregnant without even medication.
Weight loss
actually does a lot. So once you're able to work on your lifestyle and your diet, improve, do some exercises, improve your diet, you understand, reduce your carbohydrate intake, reduce your intake of carbonated drinks, a lot of Coke, Sprite, Fanta, malt, and all the likes, and then other juices. We need to reduce your sugar intake and bring it under control, and also improve your intake on fruits and a lot of vegetables. And then you begin to notice that your weight drops, and a lot of these treatments we have even instituted will actually be controlled, it will actually be very effective. Then we also control the treatment, like I said, according to the symptoms. So for example, the menstrual cycle is irregular in this individual. There are certain medications that we can give to regularize the menstrual cycle. For example, combined oral contraceptives can be given to help to regularize the menstrual cycle. Another thing is ovulation. Most of them cannot ovulate, they cannot release eggs, you understand, that can be used in fertilization. So we can give some medication that can help to induce ovulation in these individuals. And if we find out that there's an excess insulin production, when your blood sugar levels are deranged, we can now give metformin, some of these medications, antidiabetic medications that can help to control insulin levels in that individual.
Can PCOS cause miscarriage?
Yes, it can. Miscarriage is one of the complications that are associated with PCOS. And they're not only miscarriage, they're also different ones, such as infertility. Infertility is a situation where an individual cannot give birth even after trying for years or months. So those are part of complications that can result. And also, an individual with PCOS can be depressed. I mean, you're trying to get the child and it's not working, tried everything, so it can make such a person get depressed. Anxiety also can set in. You can be anxious because fear of unknown, you don't know what's going to happen, you don't know what is wrong. And also sleep apnea, a person be having difficulty with sleep, their sleeping pattern. Some people it can lead to obesity, diabetes. They are just different complications that are associated with it. So it's advisable to get immediate treatment in order to prevent it from getting worse in the nearest future.
Okay, so talking about this infertility and PCOS and fibroid, can they be linked together? Are they the same thing?
They are not the same thing at all. They are two different disease conditions. They are two different things. They are different from each other. However, both of them are as a result of hormonal imbalance, and it's treated differently. They are both found in women because their treatment is the same thing. The drug they use is the same thing, but the only similarities I would say is the hormonal imbalance and the fact that they are found in women with women on reproductive age. But there are two things that are treated differently. An individual that has PCOS does not mean you have fibroid, and someone that has fibroid does not mean you have PCOS. It's just two different disease conditions.
Okay, thank you. So, is there any other heavy that can lead to PCOS?
Oh yes. Like I said earlier, it occurs in women of reproductive age between 15 to 45. So most times women find it early on, and they discover that their menstrual cycle has never been regular. It's always infrequent and changing, and they can't actually calculate their dates. Sometimes it's long, for months they don't see it. So that is an established case right from the onset. But then there are some ladies, some women that see that it has been regular for quite some time. But when they started adding weight, there's excessive weight gain, they now notice that everything becomes irregular and everything becomes quite infrequent. And then they go and then they check and then they see that they have Polycystic Ovary Syndrome. So in that case, we can say that increase in weight gain is associated with the development of PCOS, even later on in life.
Thank you. So what are your advice for those with PCOS?
PCOS is not a death sentence.
No, it's not.
If you have PCOS, you can still have your desirable number of hits. And if you have PCOS, it is advisable to seek immediate and adequate medical attention, because if you treat it early enough, it will prevent the complications that may come in the nearest future, like infertility and the others. So it's advisable that when you just have it and your doctor tells you that okay, you have PCOS, make sure you follow the advice given to you. If it's your diet, make sure you follow the diet they tell you to follow. Make sure you eat what they tell you to eat and not live on junks and the others. So it's just advisable to treat it as the way it is. Don't feel it's normal to get scared or anxious about it, but don't allow your anxiety to overtake what you are or who you are. So PCOS is an endless sentence. With PCOS, you can still have a number of kids you want to have. And good luck in your PCOS journey.
Thank you so much for your time, Dr. Hema Apata and Nurse Adebayo Ifeoluwa. So I hope that when we call you next time, you will surely answer our call.
Yeah, we try.
Thank you. This brings us to the end of today's series. And please don't forget to like, share, and subscribe on our YouTube channel at eDOKITA. See you guys next time. Bye.